Hi, I'm Jacqueline Schwartz, occupational therapist and board certified health coach. This podcast is about coaching informed occupational therapy and what it looks like to practice our full scope with more confidence and intention. We focus on the parts of practice that determine whether change actually carries into real life, so our work leads to meaningful, lasting improvements in clients' health and participation, and so we can practice in a way that feels effective, aligned, and professionally satisfying. This isn't about becoming something different. It's about practicing occupational therapy in a more deliberate way. Let's get into today's episode. So today, in this episode, we're going to talk about why the most important work that we do as occupational therapy practitioners can happen outside of the session. So in occupational therapy, we spend a lot of time thinking and planning what's going to happen in the session. So we will have an intervention plan. Our intervention plan should be based on theory and evidence. And then with that, we'll think about the timing, what the flow of the session, like the warm up, the meat of the session, and then the closing. And we spend so much time and thoughtfulness on this. But a lot of times I find what occupational therapy practitioners is the importance of what's actually happening outside the session. So clients are with us for maybe an hour a week if we're lucky and we're in outpatient or home health, even shorter if we're in other settings. But the client lives the other 167 hours in their lives doing their, regular habits, roles, and routines. And so that's where we're going to know if the intervention is going to work or it doesn't. Doing an exercise program or doing something with me a couple of times in the clinic once a week isn't going to make a meaningful difference. It's going to be the person's ability to take something and really implement it in their daily life, which is going to make it so that they have their outcomes. So a lot of times we're training clients on things that would help them be more successful in their daily life, whether it's like a home exercise program that they need to do after illness or injury to do something like prevent a contracture or rehab their hand after like hand surgery. It could be something like energy conservation, joint protection for people with arthritis. For kids and families, it could be something like more tummy time or engaging in like handwriting exercise for the school age kiddos. So there's a lot of things that we recommend as OTs that need to happen outside of the session for the client to actually see meaningful outcomes in their life. So in this episode, I want to talk about what this looks like, how we could do it better, and how coaching could be a tool in our toolbox. So thinking about carryover could be really difficult. And that's because we are trained to do a really strong OT session when we're in the clinic face to face with the client. So we are trained to treatment plan in advance, to, set up the environment so that the person's going to have a successful session and then, thoughtfully close the session in a meaningful way. And then the client's going to go and have a great week. And the system really rewards us for this process, right? So we have productivity. So the gold stars that we get as clinicians really come from like seeing the number of clients we need to see, starting and ending sessions on time. And so a session feels good when we've come in, we have a great intervention plan, we're running on time, on schedule, seeing all the clients we need to see. And so we could be getting all of these gold stars, but if what we're doing in the clinic isn't translating into daily life, then it doesn't matter how good our intervention looked in the clinic. It matters what the person's able to do at home and how that difference is impacting their day-to-day lives. And this is important because in the clinic, we have very thoughtfully set it up so that the person is going to meet the just right challenge, right? They're going to transfer from one service to another service that maximizes their ability to transfer successfully. For a kid working on handwriting, we might set up their desk environment so that way they are supported in engaging in their handwriting. And so there's a lot of thoughtfulness that goes into this. But then at home, nothing's structured. They're transferring from different heights. Kids are working on their handwriting while sitting on the couch and the TV's blasting in the background. And so at home, things can be a lot more difficult than they are in the clinic. And we might see this, and traditionally we might document it as noncompliance or non-adherence, or like the client just didn't want to do it. But when we recommend something and the client goes home and neither engages or doesn't, then that's actually feedback. And that's what's telling us about how successful our sessions are going to be. So if something isn't carrying over from the session, maybe it didn't fit into their schedule. Maybe the person just didn't have enough energy to do more exercise. maybe we problem solved through a barrier, but it wasn't the right barrier. And there was actually a bigger barrier that was going to stop the client from engaging in our recommendation. Or maybe they just weren't really interested in change or didn't want to change, even though we really want that for them. Or that's something that, per the medical establishment, they need to do. And so when the client is going home and doing something different than what's recommended in therapy, that is not failure. It's information. And if we can meet the moment as occupational therapists, we can have more successful sessions with more successful client interactions and clients who are getting meaningful changes. So, a really good example of this is home exercise programs. A lot of occupational therapy practitioners have trained clients in home exercise programs. And so, an example of this is I might have a client who has a very specific home exercise program in acute care, right? And I've worked with the surgeon to understand what the surgeon wants. I've developed this amazing home exercise program. I have the best visuals. I have a nice handout, and we've done all of these things. And then I meet with the client. I explain to them, you've had the surgery. It's very important that you do these exercises. This is why these exercises are important. This is how these exercises help you meet your goal of living a healthy, productive life. Let's go through the exercises. And then even at the end, I might go above and beyond and be like, okay, great. So how can we integrate these exercises in your daily schedule? And a lot of times I leave it there. And the feedback that I might get would be like, sometimes you just have the home exercise program still laying on the table, or the client discharges from acute care and you see it, left in the hospital on the bedside table. Or I might talk to the client when they get back and be like, the next week, how did your home exercise program go? Did you have any questions? And they might say something like, oh, I didn't really get to it, or, oh, yeah, I did it. It was fine. But it isn't like a ton of information, and you don't really know if they did the home exercise program and if it worked for them or it didn't. And as a new grad, I might say something like, oh, that's okay. We'll just do it now, or don't worry, you could try again next week. And while that might feel better in the moment, it's not helping the client to have better outcomes. And none of these are done with bad intention or bad skill, but they're not the most effective way to help people have behavior change and get the outcomes that they want to get at the end of the day. And so a better way to do it would be if a client comes in and says, I'm like, oh, how'd the home exercise program go? And they say like, oh, I didn't get to it, or I only did it one time. I might, instead of saying like, oh, it's okay, that's a great time to open the door for a coaching conversation and understand like what their week looked like, had they planned on doing the exercise program, like what got in the way, what were the barriers, what was their readiness to change, like do they seem motivated to do this home exercise program, and is the plan like, maybe I talked with the surgeon and we identified like these 10 exercises, and those 10 exercises are going to give people the best outcome after having the surgery. But if a person can't go home and implement those 10 exercises, then they're not going to be very effective for this person. And so maybe a more realistic home exercise program for that client might be 3 exercises, and having 3 exercises that they will do over 10 exercises that they're never going to do is going to be a much better plan and give them better outcomes, even if it's not the most optimal outcome that we or the surgeon would have hoped for the client. And so missing the home exercise program isn't the problem, and our intervention planning isn't the problem. It's missing these coaching conversations and this window into having a real conversation about what the barriers are that can help people bridge from having an intervention to actually implementing the intervention in their day-to-day lives so they could get those outcomes that they want. So oftentimes these coaching conversations can be more important than the exercises that we're actually recommending. These conversations can show up in a bunch of different places, right? A lot of times it might be like when we're walking a client to the therapy gym, or greeting them at the entrance and bringing them back to the outpatient clinic. Or it might be while we're changing equipment or sanitizing something, right? A client might say like, oh, I didn't get to it this week, or this felt really hard for me. And it might not be the most optimal time to sit down and have a coaching conversation. It might not be the intervention that I had planned for at the beginning of those sessions, but the best time to have a conversation is when the client brings it up to you and is opening the door, showing that they are ready for change. And as we talked about at the beginning, a lot of times the things that we get gold stars for are documentation and running and starting on time. And these coaching conversations don't necessarily hit those gold stars. We, as occupational therapy practitioners, have to work. We have to find a way that this conversation fits within our billing codes because we're supporting people in ADL or IADL training or therapeutic exercise, right? We might have to fit this in a session and prioritize this coaching conversation over something else that we had planned in the session in order to stay on time and meet the metrics that we are given. And so a lot of times people hear using this coaching intervention and think, oh, that's not coaching. That's just occupational therapy. And that's exactly what coaching is. You don't have to take off your OT hat and put on a coaching hat and work as a coach. Coaching can be a tool in your OT intervention that makes what you're already doing as an OT even more impactful. It can be uncomfortable, right? Because you think about OT and you can be expecting the OT to be getting people up and out of bed, getting them on the machines, like doing the exercises, getting in the shower. And so sometimes when you see an OT stopped having a conversation with someone, it can look like not a lot of work is going on. But we know that with coaching, it's an evidence-based practice. And then taking the moment to stop and have the conversation with the person when they open the door can be some of the most meaningful work that you do as an occupational therapy practitioner. And asking the right question at the right time can be some of the most skilled work that you do across your day. So we're not talking about changing professions, and we're not talking about adding like a whole nother intervention on top of what you're already doing. We're talking about refining your processes and integrating coaching into the moments that you already have so that way you can have even better outcomes. We know that occupational therapy practitioners already listen and reflect and think about readiness and adapt based on the person, the environment, and the occupation. And so the benefit of a coaching intervention is it helps you give additional structure to these conversations. It gives you a framework that's evidence-based and theory-driven, and it really gives you the confidence because I know as a new grad, I didn't have as much skill as I have now in negotiating these conversations. And through the coaching training, I feel more confident in making sure that I know the best next question to ask and why I'm asking it and why that question is going to be effective. And I know the evidence-based for coaching. And so that makes it easier for me to talk about in my documentation and talk about to the client and talk about to my fellow practitioners. And even though this isn't new work, now we have a name for it and a framework, and it makes it a little bit easier. So this week, as you see your occupational therapy clients, just take a minute to think about how you can help your clients transition what you're working on in the session outside. And then also consider at the beginning of your session, reflecting with the client back on how well they were able to implement previous interventions outside the session. And then take that information to help you develop a treatment plan for that session and in the future to create something that the client's going to be able to really take and be successful with so that way they can have the best outcomes. And again, this isn't going to look dramatic. It's not going to be a whole intervention that you're doing on top of your already full schedule. It's just taking these few moments and adding a bit of intention, a bit of skill, and it can really change outcomes. And that's the thought for this week on Health Coach OT. If something from this episode resonates, I'd encourage you to notice where it shows up in your own practice this week. Often the shift isn't a new intervention, it's a more deliberate conversation. If you'd like a more structured way to think about integrating coaching skills into your OT practice, you can download the OT Coaching Intervention Framework on the Health Coach OT website. It's designed to help you practice your full scope with more clarity and confidence. Thank you for listening. I'll talk to you next week.